Well, good morning, everybody. Welcome to today's webinar, COVID-19, the long haul. I'm Amy Bennett, Chief Marketing Officer at Impact Assets. Thank you for being here today. We're grateful for your interest and for sharing your valuable time with us. We want to hear from you, so please submit your questions throughout the discussion using the Zoom's Q&A function in the menu bar at the bottom of your screen. We will be devoting some time at the end of the discussion to Q&A. We'll also be putting contact information in the chat during the discussion. This session will be recorded and sent to all registrants in a follow-up email. And at this time, I'd like to introduce Margaret Trilly, who will be facilitating our discussion today. Margaret serves as CEO of Impact Assets, a $1.4 billion non-profit impact investing and philanthropic advisor. And at this time, I'd like to hand it over to you, Margaret.
Thank you, Amy. Well, the impetus of this webinar came together in the fall. As many of you know, Impact Assets has been working with our clients who are philanthropists and impact investors since the beginning of the pandemic to direct their efforts to the most pressing needs of the moment. And those needs were evolving rapidly as the pandemic played out. In the fall, those efforts and that flurry of activity seemed to slow. And I think it was a confluence of things colliding to create that dynamic. We had optimism, we had a new administration coming in, we had news of vaccines, but we also had and still have fatigue. And this is like unlike any other cause we support, in that we are all personally impacted and collectively impacted at the same time. And we're all feeling collectively frayed. We need this to be over. We need this viscerally to be back to business as usual, back to philanthropy as usual. But the pandemic has continued to throw curveballs, and we as philanthropists and impact investors are needed more than ever. So today we're going to hear from two panels. The first will discuss that need, where we are now and what's ahead. We have nationally recognized epidemiologists Saira Medad and Jennifer Nuzzo, who I will introduce in just a moment. The second panel focuses on how philanthropists and impact investors can play a role, the role that only we can play in getting humanity through this, by hearing from the amazing work happening at Schmidt Futures. We have Tom Khalil here to discuss that with us. And we're also joined by Sharon Knight, who's the executive director of Stop the Spread, which is an organization dedicated to activating players and partnerships to defeat COVID. So we start with the need and the critical gaps in pandemic response. Joining us now is Saira Medad, a nationally recognized leader and epidemiologist in public health and special pathogen preparedness and response. She is the senior director of the system-wide special pathogens program in New York City's Health and Hospitals, and she's the principal investigator of New York City Health and Hospitals Center for Global Health Preparedness to Special Pathogens. Dr. Medad is also an adjunct senior fellow to the Federation of American Scientists and part of their COVID expert task force. Jennifer Nuzzo also joins us from Johns Hopkins Center for Health Security. Dr. Nuzzo is a senior scholar at the Johns Hopkins Center for Health Security, associate professor in the Department of Environmental Health and Engineering and a Department of Epidemiology. And she's a senior fellow for the Global Health at the Council of Foreign Relations. She directs the Outbreak Observatory, which connects operational research to providing outbreak preparedness and response. Dr. Nuzzo is also the leading epidemiologist for the Johns Hopkins COVID-19 Testing Insights Initiative, housed within the Johns Hopkins Coronavirus Resource Center. Welcome, Drs. Medad and Nuzzo. Thank you so much for joining us today.
Having us.
So, Dr. Medad, with vaccines now starting to become available, there seems to be this feeling that there's a light at the end of the tunnel. We're almost through this. We're done, right? So I think I'd love to hear your response to that, and also your sense for how long it's going to be before we're back to normal, and what could derail us on that path to normalcy.
Well, excellent question. So first, what can derail us? I think we're seeing what's playing out right now. It's the variants and so many other things. But I think just to take a step back, we have highly efficacious vaccines. They certainly have the potential to help end the pandemic, but vaccines alone are not going to end this global pandemic that we're in. And there's a couple of different reasons for that. But first, I think the most basic reason is transmission is way too high, just not just here in the United States, but all around the world. And we need to continue to interrupt community transmission by looking at the full control measures that we have. So vaccines play one role in it, but when we talk about community level mitigation measures, so looking at the restrictions that we need to continue to abide by and employ, and then individual measures, right? So making sure that masking, physical distancing, and then measures that we need to help with epidemic control. Testing is a really big thing. We absolutely need to continue to ramp up testing to help with curtailing the spread of COVID-19 and interrupting the chains of transmission. We need to invest more in therapeutics. That's another big area that needs ongoing support and just more work in. I think when we also talk about additional preventative measures, obviously the NPIs that I've already mentioned, but all of those things will continue to play a very, very big role with the end goal of interrupting obviously chains of transmission. The one thing that I'll mention when we talk about COVID-19 vaccines, as great as they are, and certainly the potential to end the pandemic, there's going to be instances where people can't get the vaccine, right? And they can fall under a couple of different categories. They can't because of contraindications. They can't because, do we have vaccine hesitancy? You have the anti-vax movement. And I think that alone needs to obviously be addressed through education and being informed. And then you have people that just don't have access to the vaccines, not just in the United States, but around the world. And so vaccines play a very vital role, but so do all the other control measures like testing and obviously the NPIs.
Thank you. Thank you. So, Dr. Nuzzo, the Biden-Harris COVID response plan was refreshing to see. It hit all the major areas we've been reading about. Are we set now? We tend to define philanthropy's role as addressing the gaps between the government response and the private sector response. Are there any gaps for philanthropy to address after such a comprehensive plan and after having vaccinations on the horizon?
Sure. Well, I think a number of us, many people are very excited to see finally a comprehensive national plan. I mean, first of all, just having a national plan was exciting, but the fact that it is so comprehensive is also tremendously encouraging. And so I think there may be a temptation to see the plan and think, aha, that's it. Finally, we've reached the end. But the reality is there is a lot of hard work ahead. First of all, the plan will take resources, and we don't yet have those resources in place. And second of all, government is never going to be able to do all of this alone. There are some key areas that I think we have neglected entirely, and there are some key areas that maybe we had attention on, but are starting to flail. The first one is that we haven't sufficiently addressed the kind of social and economic drivers of compliance with public health interventions. And so we talk about reducing your risk and staying home as much as possible and wearing masks and trying to avoid crowded indoor spaces. But the reality is not all of us can do that equally. Some of us can't. People who have to work, people who have to go out and support their family, people who don't have the luxury of spending their entire day on Zoom. So there are a number of concerns that we still have, and so we need to make sure that we can sufficiently protect those people. And there's fairly good evidence that not everybody can afford the protective measures, simply even considering masks. That is potentially a cost out of reach for many people. The other concern that I have, and I'm glad Sarah mentioned this about testing and testing remaining important, is that those efforts really have faltered as of late. We have basically plateaued testing ever since Thanksgiving, and yet our case numbers have increased. And so what that tells us is that we are starting to miss infections, and we're not counting them as cases, and we're missing opportunities to interrupt transmission from the people who are walking around not knowing that they're infected. There are important barriers to getting tested. It's not just a technological problem that we need to fix. It's also the fact that if you're, say, an essential worker, and maybe you're just a contact of a case, or you're someone who has very mild symptoms, the kind of calculation for you to get tested may not be a favorable one if getting tested and testing positive means that you can't go to work for possibly a couple of weeks. You may lose an income during that time. You may not be able to support your family as a result. And you may possibly lose your job because you're no longer seen as a dependable employee. The same thing goes for people who are not even feeling sick, but maybe just had been exposed to somebody who did become a case. So we really need to have solutions that help people comply with those directives. And it's going to take a mix of government, but also social organizations, philanthropy. I mean, it really is going to take all hands. And then finally, I'm very, very encouraged to see equity at the core of the Biden-Harris COVID plan, because we know that not all of us have been equally affected by the virus. But you're going to see tensions in the coming weeks with how we can actually follow through on those equity goals. Namely, I think vaccine rollout is a particularly good one, where there's going to be a tension between getting vaccines in arms as quickly as possible, and also making sure that the people who have been hardest hit by the virus have access to it. And unfortunately, the tools of expediency, having mass vaccination clinics, sending out emails to sign up, those are tools that are not available to everyone. And so we're going to have to still do more slow, exacting stepwise work to make sure we achieve our equity goals and to reach underserved communities who, may take just frankly more effort to try to get vaccinated. And that's really where partnership with non-governmental organizations is quite critical.
Yes, distressing, to say the least. Syra, Jennifer just mentioned the impacts on vulnerable communities, low-income communities, often communities of color. Can you say more specifically about the pandemic response and how those communities have been hit by the pandemic and the health effects of this moment?
Yeah, so completely agree with everything that Jennifer just mentioned. And here in New York City, and being part of the response that we have, as well as being the first epicenter, I think we've learned a lot. And I think just nationally and even universally, some of the issues that are front and center, obviously, are not new. It's just that COVID-19 has added fuel to the fire. And when we look at some of the inequities that we're seeing, particularly locally and nationally, you're seeing, obviously, just looking at the data, looking at the stats, Indigenous, Black, and Hispanic people of color, were 2.7 times, more likely to have died of COVID-19 than white Americans, and that's just a fact looking at the data. If you drill further down into it, one of the things that I'll mention is everybody heard of Elmer's Hospital in the news early on in New York City as being one of the hospitals that was, overwhelmed with the surge of COVID-19. If you dig deeper into that, if you look at the community that it was serving, it was such a underserved community. It is an underserved community. It's made up of a number of individuals of color, immigrant population, multi-generational homes. And if you look even deeper into it, you see some of the economic inequalities there. And so, again, not surprising that if you look at some of the data, if you look at some of the hardest hit communities and you look at some of the social and economic factors that go into it, it just shows you where there needs to be a lot more work that needs to be done. There are systemic inequalities within healthcare in this country, obviously in unequal access to various different opportunities, and then looking just at bias and discrimination. All of those are different, and they all play a very significant role and have a very significant impact to the health of individuals. And I think some of the things that are happening to address that, both at the national level along with the local level, because everything needs to happen at the local level. You have a great national response, but all these initiatives, the entire response really starts locally and then goes up from there. And so one of the things that I think needs to be highlighted further are, for example, COVID-19 recovery centers. As we know with COVID-19, the long haul COVID-19 is an epidemic in and of itself. And you're hearing about it in the news, but what you're not hearing about is it is an epidemic and it's only going to continue to grow. The more cases we have of COVID-19, the more long haulers we're going to have. And what that's going to happen in the short term and long term, you can already start seeing some of the ramifications. And so we have what we call the COVID-19 recovery centers, and they're located in some of the hardest hit communities, particularly here in New York City, and nationally you're seeing more of it, but we need more of them. And we need to address this head on. There's so many additional health issues that are going to stem out of COVID-19 that absolutely need to be addressed through a systemic way, through a way that is sustainable. This is not just one and done type of approach. We also need to look at support services, as Jennifer mentioned. And I particularly have been heavily involved with the support services, for example, helping with standing up isolation and quarantine hotels. So in New York City, we have a lot of them, and I've been helping support them providing guidance and looking at the infection control measures and things like that. And we just recently published a guidance on it with CDC. But one of the things that we often see, and as Jennifer mentioned, is not everybody has a luxury to isolate or quarantine at home. So it's really important that we provide these services. It's not enough to just give them a call and say, hey, you have COVID-19 or you've been exposed to somebody, but what can we offer them, to ensure that either they're staying home or they're in a safe place where they can, isolate properly. And then along with that, it's also providing other support services, the healthcare services, the meal delivery. If you're looking at some of the data, a lot of people tend to venture out to get food, groceries, things like that. So we need to look at it from a holistic standpoint, really to support these individuals as much as we can. Because again, the end goal is trying to curtail the spread of COVID-19 and as, have as many dead ends in terms of, making sure that individuals are staying home and not infecting other people. And so a lot of that obviously plays a very, very big role. Healthcare plays a very big role. Public health plays a big role. So there certainly needs to be a lot more investing and looking at these inequalities. How can we meet people where they are and then providing the resources that they need?
Thank you. Definitely. It's so heartbreaking to hear again that the disparities are playing out. I mean, those communities have been set back so far. Already, they're already so disadvantaged, and then to have this on top of it is really heartbreaking. Jennifer, could you talk a little bit more about those wraparound services? You recently, both of you recently co-authored an op-ed in Health Affairs talking about wraparound services. Could you please share with us what these are, why they're so important, and how you're thinking about those, Jennifer?
Sure. Well, CIRA is really a national leader on the provision of those services and planning for them. I will just say, it is a global health best practice that when you are planning a public health intervention, you need to consider people's ability, not just their willingness, but their ability to comply. And in some cases, you need to provide incentives. So if you tell somebody that they need to stay home for, say, 14 days, some people may not be able to do that. If they live alone and they need to, receive groceries and they have a pet that needs being taken to the vet, or they have an elderly relative that needs to be cared for. I mean, there are just some barriers that for some people, they are just not able to quarantine or isolate until those barriers are overcome. And, when we look globally at the experience with the non-pharmaceutical interventions, particularly these case-based ones that are going after people we think may be infected, isolation and quarantine, many other countries are much further ahead in supporting people in isolation and quarantine, sometimes by, as I referenced, providing income replacement so that they don't have to work, choose between earning an income and following public health guidelines. Sometimes it's provision of meals, sometimes it's provision of, some kind of case management to follow up on them to make sure that they're okay. And sometimes it's social services to meet their other needs. So we know that this is something that helps achieve compliance, and yet for some reason we haven't, in my view, sufficiently implemented this in the U.S. And we heard over the summer. I mean, I think New York is really ahead of the game compared to many other states, but we heard over the summer that not being able to offer contacts of cases, anything, was an incredible disincentive for people. And they would just say, no, I don't know that person. I wasn't a contact, or they wouldn't even answer the call. And so, the public health officials have been given this incredibly hard job to do the very exacting, and frankly, it's more of an art than a science work of contact tracing and even case investigation, with having, very limited tools and incentives to offer people to participate.
Well, I would love to hear from you both, just, building on all of this, about the most important changes you'd like to see to address all of these disparities and inequities. What more do we need to do around our social safety net, not only to address COVID, but to address the inequitable impacts of future pandemics?
Sure,
Jennifer, why don't you lead us, or Sarah, lead us off.
No. Jen, if you'd like to go first, go ahead.
Okay, sure. So, I mean, there's a few things. Clearly, we need to expand our offering of wraparound services as a tool to, boost the effectiveness of the testing, tracing, isolation, and quarantine efforts that we are very much need to still do, even as we're rolling out vaccines. So that is the absolute first thing. And I'm glad to see that it's in the plan, but there still is work to be done. First of all, we've got to get the funding for the plan, which is potentially always an uphill battle. Then we also need to implement the plan, and we need to implement the plan at the state, the local, and hyperlocal level, and that will demand partnerships. It's just nothing that these very overstretched health department officials can do on top of everything else that they're doing. So that is one thing. The other thing is, as we are rolling out vaccines, I really do think that there's going to be need to make sure we achieve our equity goals and to make sure that we do not leave any communities behind. And that has to be a bottom-up approach with, appropriate resources to be able to enable it. I am also deeply worried about the spread of mis and disinformation. And I really think that this is going to take an all of the globe, but really approach to combat this, because we are hearing really alarming stories about people refusing vaccines based on information that they've heard, and there are very organized groups that are spreading this information, targeting some of the hardest hit communities intentionally. And so if you have disproportionate impacts on Black and Brown communities, and they are being targeted by the anti-vaccination groups that are highly organized and coordinating, it's a really dangerous situation that we're in. And then finally, I think we also need to have a global view of this, because even as we hopefully are expediting our efforts to control the virus in the US, and we're rolling out vaccine, and it's great that we haven't projected to have enough vaccine for the US population, I think what the variants have taught us is that as long as this virus continues to circulate on the planet, there still is the possibility that mutations could occur that could overtake the vaccines and the therapeutics and all the other tools that we have. And so it really is in all countries' best interests to make sure that all countries are doing well. We learned this over the summer when some US states were doing well and others weren't. And then the states that had been doing well saw a rise in cases because, it was inevitable. They couldn't keep it out. And I'm afraid that we're going to learn that lesson again if we only focus inward and take care of the US and don't look across the globe, and the need to ensure that all countries are doing well. Particularly worried about the resurgence of cases on the African continent, and the fact that there's a statistic that 25 vaccinations have been administered on the continent. So that just shows you the extraordinary, as opposed to the 25 plus million vaccines that have been administered in the United States. It just shows you the extraordinary global disparities, and we absolutely, as Americans, need to address that for our own safety, if not just for the morality of it.
So those are excellent points, and I think just to maybe add on a few more to mention. So there's obviously the short term, and then there's a long term. And I think both of us being in this particular field of outbreak response, I think we are very much tired of the bubblegum and Band-Aid approach that we've often had to epidemic response. We're very much tired of the boom and bust cycle when it comes to funding, where we build an entire infrastructure and then it dissipates because the threat no longer is there. And in particular, one of the things that I'll highlight is the Regional Ebola and Spectral Pathogen Treatment Network. We have over 6,000 hospitals in the United States. A lot of funding was given after the Ebola epidemic for all spectral pathogens, not just for Ebola, to maintain the state of preparedness we have across our healthcare systems. I wrote about it 4 days before COVID-19 was even known in the Washington Post. And in the middle of the pandemic, Congress failed to actually reinstate and issue additional funding. And unfortunately, that entire network dissipated with the exception of 10 regional centers. And as we know, it's not just 10 hospitals that are on the front line, it's all 6,090 hospitals in the United States. And so first, we need to look at long-term solutions and not short-term. Short-term, it's obviously how can we flatten the curve? And it's about everything that we just talked about, but it's also about how can we maintain that flattening of the curve, and then making sure that we're prepared for the next epidemic and pandemic. And nothing should ever go from an epidemic to a state of pandemic. We can certainly prevent that. We can prevent the next pandemic. So we need to address the epidemics that are happening. And in order for us to do that, there needs to be a lot more support, both politically, financially, and the will of the people. And I think a couple of things that I'll highlight to ensure that, that we certainly need is, this is certainly the time to rewrite our pandemic playbook. It's not just about obviously looking at investing in the therapeutics, investing in the resources that we need, but it's building a better infrastructure for the future. And one thing that this pandemic has highlighted that we absolutely need to rectify is we need to move away from that just-in-time strategy that we have employed since the beginning. It's all just in time, right? So I need more PPE because I didn't have enough reserve, and now we're shortchanged because everybody's looking for the same PPE. We need more supplies, but it's all shortchanged. So we absolutely need to move away from this just-in-time mentality to more of a preparedness state to make sure that how can we build an infrastructure that is better for today and for tomorrow that we can certainly turn on. And that's going to require a lot of thinking and investment, because certainly, you when you look at it from an investment standpoint, you may not see the need right away. You may not see it being used right away, but it's going to have, multiple dividends in the future. And if you look at just the COVID-19 pandemic, what we're paying and what we're hemorrhaging in response, we could have certainly, saved more than half of that, if we just prepared better and responded better. So, I think it's just first building a better infrastructure and moving away from that just in time that we have and looking at it from the entire standpoint of not just the testing and how can we maintain a state of good testing and therapeutics, but also looking at the staffing model, looking at the human resources that's required. And one thing that we've certainly faced is we had a huge issue with staffing, not just at the healthcare level, but at the public health level. Just getting enough contact tracers. We still don't have enough contact tracers across the United States. We need more community engagement. We need more community engagement specialists, that is not just for COVID-19, but for all different threats. And so we need to certainly look at all these different avenues that play into it. The other thing that I'll mention that Jennifer already highlighted is we certainly need to do more with combating the misinformation, disinformation. So now we're at a stage in the COVID-19 pandemic where we have two highly efficacious vaccines. And if you're following some of the data, just within the healthcare workforce, you're seeing so much vaccine hesitancy. And if you're privy to some of the surveys that are coming out, you're seeing that it's not just the general public that's hesitant, it's also healthcare workers, because they're not immune to the politicalization and the misinformation, disinformation. People often think that healthcare workers should know better, but there's so many different educational levels within healthcare workers, and these are the messengers. So we absolutely need to start combating misinformation, disinformation at all different angles, at the community level, at the national level, at the international level. And absolutely, we need to look at it from a global health lens. Global health security is absolutely vital to all of us. And I think Jennifer laid out exactly why that is so important. So those are just a couple of my 2 cents.
Thank you. Thank you both for making that depressing reality painfully clear. Really, it's not enough to be vaccinated yourself. We all have to be vaccinated, or the mutations, the variations really can set us all the way back to the beginning. And it's going to take continued distancing, masking, vaccination, testing, all of the cylinders we have and the levers we have available to us firing at the same time to end this pandemic. So thank you, Jennifer Nuzzo and Saira Madad. We'll see you back at the end for Q&A. Next up is our panel on philanthropists addressing COVID. So we just heard that there is cause for optimism, but there are still critical gaps to be addressed, particularly for vulnerable communities who've been hardest hit both by the pandemic and the economic downturn. So in this next section, we turn to hearing from how prominent philanthropists and impact investors have stepped up to address these disparities. Joining us is Tom Khalil. He serves as Chief Innovation Officer for Schmidt Futures. In that capacity, he has supported initiatives related to the pandemic, such as increasing the supply of PPE, investing in COVID-related biomedical research, and strengthening the COVID response of our nation's governors. Prior to Schmidt Futures, Tom served in the White House for 2 presidents, President Obama and President Clinton, helping to design and launch national science and technology initiatives. Thanks for joining us, Tom. We also have Sharon Knight joining us. Sharon is the Executive Director of Stop the Spread. For those of you who don't know, Impact Assets has partnered closely with Stop the Spread as we worked with our clients to address solutions for COVID solutions for philanthropists and impact investors. Stop the Spread's mission is to meet the needs of unserved communities during the COVID crisis, and they're advised by an expert advisory board, which Dr. Saira Madad and Jennifer Nuzzo both sit on. Prior to joining Stop the Spread, Sharon was the president of One Medical and the president and COO of Hawthorne Effect, which is a company focused on democratizing clinical trials. Thank you both for joining.
Thank you.
So Tom, we'll start with you. Schmidt Futures has been at the forefront of the COVID response. And at the end of our time, I would love for our audience to have a really good picture of the arc of your efforts and how they've evolved as the pandemic itself has evolved. I'd love to start though with the organizations you've been funding, in particular, noting those that still need funding as the pandemic rages on.
Yeah, so one partnership that has been really high impact is as you said, working with our nation's governors, particularly through the National Governors Association Center for Best Practices. So this is the 501c3 arm of the NGA, and it was all supported with very directed funding. And so it limited the ability of the NGA to be more flexible and to respond to the pandemic. So we feel really good about that investment because it allowed them to share best practices, number one. And number two, also to highlight issues that nonprofits were coming up with solutions for. So we support an organization called Recidiviz, which has been helping with a number of governors try to protect prison populations and reduce deaths in our prison populations. So that's one example. We also supported the US digital response. So this is a network of volunteer technologists who are willing to drop everything and help state and local government with a response. So for example, in the vaccine area, they're helping states with their data reporting needs, inventory management, resident eligibility screening, and vaccine reporting. So they've been able to mobilize hundreds of technical volunteers to help our state and local governments. There was discussion about vaccine hesitancy and the importance of getting the right information to people. We supported the Pandemic Action Network, which has been launching both national and global messaging campaigns around key public health messages like wearing a mask, for example. And then we've been supporting research, including right here in the Bay Area, Manu Prakash, who's a bioengineering professor at Stanford, who's been developing low-cost technologies that will be helpful not only in the United States, but around the world in low-resource settings. So those are a couple of examples of the dozens of grants that we've been making related to the pandemic.
Wow, that's terrific. And your response has just evolved as the pandemic has evolved. And same with you, Sharon, at Stop the Spread. The organization started with forging public and private partnerships. And then towards the end of the last year, you pivoted, taking up matchmaking and enablement capabilities to a hyper-local level, targeting those very vulnerable communities we've been talking about. You've been virtually on the ground speaking with these communities, or through Zoom on the ground. And so what are you seeing, and what is Stop the Spread doing to address those challenges?
Thank you, Margaret. You're correct. Stop the Spread's initial focus was on catalyzing the private sector to step up and address shortfalls in our nation's response to the pandemic. And so that had us initially focusing on ventilator production and then PPE, and then our focus expanded to novel diagnostics and therapeutics. And we also did some work in food insecurity. The critical needs are large and have been evolving. But after 6 months of supporting those companies with a lens of accessibility and affordability, we realized that there was an opportunity to direct those solutions into underserved communities that had been hardest hit by the pandemic. So influenced by advisors like Syra and Jennifer, we expanded our focus to lend hyperlocal support to CBOs and healthcare organizations that are fighting the pandemic in their communities. And we embrace those that score highest in terms of social vulnerability, percentage of minority populations, and the prevalence of COVID. By our analysis, there are 600 counties approximately, or 20% of total throughout the US that meet this definition, and 35 where the need is absolutely severe. So the need is both prevalent and enormous. Very simply, what we seek to do is to work with trusted organizations within underserved communities to empower and help them to combat the pandemic. If needed, we assist them with assessing what the critical needs are, which are often many due to a lack of resources, and we connect them with vetted solutions from our partner network that can fill these gaps. We then support them with implementation and provide additional resources, including cash assistance that Jennifer and Syra alluded to are so important for many individuals. The biggest challenge isn't that communities don't know what they need, is that they lack the resources to wage what I feel like is a war on multiple fronts right now. I think it's important to note that the solution in these communities is not a one size fits all approach, because every community is different. But while the pressing need for right now is getting people vaccinated, there's still a significant need for testing. We talked about that a little bit earlier, that this pandemic is not going to be solved with vaccinations alone. And studies since the beginning of the pandemic has shown that minority populations are underrepresented in terms of their access to testing, despite being overrepresented in case and death counts. Unfortunately, the early information that's coming out about vaccinations is that the same pattern is holding true with respect to access to vaccinations. So the needs, however, are greater than this in our conversations with communities. Obviously, with a name like Stop the Spread, our organization immediately engages around direct pandemic response. But these communities, havoc has been wreaked. Existing healthcare disparities have been widened. Care is harder to access, particularly where there's a digital divide. So many of the solutions are turning towards virtual health, telehealth type solutions. But if you don't have access to technology, or you're computer illiterate, or you don't have reliable broadband, that doesn't help you a whole lot. Mental health has declined precipitously. Food insecurity is at an all-time high. And economically, whose savings have been depleted as people struggle to feed their families and just keep a roof over their head. And as Syra and Jennifer discussed, the need to work has made it challenging for people to comply with what we feel maybe are basic health directives without financial support. So it's prevalent and enormous.
Certainly. Wow, that's it's a daunting task for sure. So Tom, I have enjoyed our conversations immensely about the role of philanthropy in crisis, and I have to admit that you have moved my view of that role in any crisis. So we historically think of philanthropy as addressing the gap between public and private response. You've had some really interesting stories and experience in the White House and with Schmidt Futures in ways that philanthropy has partnered with or enabled government in a lot of ways. And I'd love for you to talk a little bit about that.
And I think that there's been a real recognition that if you want the government to actually be able to deliver and live up to the goals that it's setting, you need lots of different types of people in the government. And some of those people are people who have skills in technology implementation and delivery. So we supported something called the Tech Talent Project, which was designed to, number one, identify the 100 most important positions, and for each of those have 2 to 3 really strong candidates. Because we supported the Tech Talent Project, they were in a position to identify very strong candidates who are technologists, and a number of them began to think about what role that they might play in the fight against the pandemic and really allow the administration to hit the ground running. So by supporting this talent bank, that we've gotten some feedback that was immensely helpful to the administration, because not only did we have really strong candidates, they had already been thinking about the role that they could play in using technology in the fight against the pandemic.
That's fascinating. Could you talk a little bit about your work in New York with Governor Cuomo?
Sure, yeah. So the governor asked Eric Schmidt to help lead a commission on reimagining New York. And so as a result, he, along with other leaders in the private sector, philanthropy, and civil society, has developed a number of concrete recommendations, not only about fighting the pandemic, but improving what happens afterwards. So for example, one of the things that the pandemic highlighted is that we still have a very large digital divide. And so learning loss for low-income students is going to be higher. And so the commission developed a set of recommendations with respect to bridging the digital divide, ensuring that more, particularly children have access to broadband and to digital devices. And that's something that the governor has signaled in his State of the State address is going to be a priority for him. And both Schmidt Futures and other funders are looking at how we can get this initiative started with philanthropic funding.
That's terrific. I love that kind of partnership. I love seeing that happen. So let's say we've achieved our goal today in re-energizing some of our friends in philanthropy to consider the continuance of COVID funding. So what are some of the ways to activate on the great work you're doing or the great work you're seeing others do? I would love to hear from both of you on the types of things you're seeing down in the field. Tom, why don't we start with you?
We should have a never again moment where we resolve to dramatically improve our ability to respond to future pandemics. There's a great report that has just come out called the Apollo Program for Biodefense that has a scientific and technological roadmap for how we could do that. And I think that's something that philanthropists and foundations should get behind it and support. So I think obviously we need to end the current pandemic, but we should resolve to dramatically improve our ability to respond to future pandemics.
I don't disagree. Sharon, how about you?
Yeah, we are working with CBOs throughout the United States that have a pressing need for funding to address all the needs I referenced earlier. However, the biggest need we're hearing from organizations right now is really for staffing support to increase their reach and their throughput. This is particularly true as the supply of vaccines becomes more available. Local health organizations are being forced to choose between vaccinations and administering care, and testing, which we talked about is still, badly being needed, is kind of falling by the wayside. We're hearing reports, and we've experienced ourselves where we have tests to donate to community health clinics and to FQHCs, and they're saying, no thanks, we have our own supplies that are already expiring. So that's extremely concerning. I think also there aren't enough community health workers or community engagement specialists, as Syra mentioned, who play an important role in engagement and information dissemination, particularly with those who may be hesitant to get the vaccine. And given vaccinations, as I said, aren't the whole story, but they are a welcome entry point into communities right now. So that's really guiding two key focus areas for us right now, and Jennifer and Syra and Tom all touched on these, helping combat misinformation, ensuring that communities have access to culturally relevant communication materials to combat vaccine hesitancy. So we're supporting organizations like the COVID Prevention Network, Civic Nation, and the COVID Collaborative, all that are doing really fantastic work in this regard. But we feel like right now, let's say, upcoming February, March, it's about providing understandable and consistent information to people so they can become informed and make their own decisions. It isn't about telling them to rush out and get a vaccine because the supplies aren't available yet, but get informed and get on board so they know where they are in the queue and they know where they'll be able to access a vaccination. The other focus is standing up community-based vaccination sites and mobile vaccination units to get more vaccines in the arms of people. Our focus is on the people who are at the most risk of contracting the virus and at the most risk of transmission based on their household situation. So the nature of their work that puts them out in the community and then coming back home into multi-generational households or multiple families under one roof. These are the people who need the focus, and where, as our advisors have said, that vaccine misinformation is being actively directed. So those are our two principal focuses right now. And I think it's important to note, although we have the ability to direct capital and programmatic support into the communities that we're already engaged with, we are very happy to work with funders to engage communities that are important to them. As I mentioned before, we think there are probably at least 600 communities that could use a holistic programmatic support, and many that are severely in need.
Definitely.
One thing
Well,
that Sharon said,
go ahead.
which is she talked about Civic Nation, and I think one very clever idea that they have is to leverage the infrastructure of all of the community-based organizations that have been working on the census. That work has more or less wrapped up. So I think there's an opportunity to take advantage of that infrastructure that's been created with those community-based organizations that already have trust and can be used to help address issues related to vaccine hesitancy. So I think that's a really interesting investment opportunity for.
Yeah, I don't think we can overemphasize the importance of trust in working with trusted community organizations and supporting those organizations and individuals who already have the relationships and have the trust. This isn't imposing something upon them, but empowering them to do more and increase their reach and impact.
Most certainly. And we've seen through, there's researchers and academics who have written and studied this dynamic, that there really is no movement in those communities that can be successful without the leaders of those organizations actually leading those movements. And one of the things that I admire so much about your approach, Sharon, and the approach of Civic Nation and the others, is that they're really putting community leaders in the center of their response and working through them, and just empowering them to address the issues for their communities. It's such an important nuance that often gets missed. Okay, so we are ready to transition to our Q&A session. We've had, we'll have Jennifer Nuzzo and Syra Madad join us again for the Q&A. We have a ton of questions that have come in. And I'm gonna combine some and paraphrase some others. So I'm gonna do my best to get to all these, but I think that's gonna be a tall order. So the first one is for Jennifer or Syra. Where are we in getting affordable $5 home COVID tests available in the marketplace? This would go a long way to empowering individuals to test themselves and help prevent the spread in the community, and also allow for increased economic activities.
So there are home tests available now, which I think it's encouraging that we have more options for people to test themselves. I don't think they're $5. There are $5 tests available, not for use at home, but there also is a need for tests that are rapid and cheaper than $5. So if we want to think about doing screening in, venues, schools, other places, for instance, where you're doing a lot of screening and you need test results quickly, even $5 is probably too much. There are people who are pushing for, other testing options to provide a quick screen for people who may be the most contagious.
The only thing I'll add on to that, what Jen mentioned, is we just also need to look at the regulatory component. There's a lot of hurdles of not just obviously developing it, but then also bringing it onto market and then comparing these tests to diagnostic tests, which are very different. So these are the rapid tests are for public health use for surveillance and screening, and they're very different. So there's a big regulatory hurdle to overcome there as well.
Most certainly. I know, and Sharon has been working with a ton of organizations who have affordable, rapid testing with high mobility that are going to be great solutions for vulnerable communities for the global South, and they're all awaiting emergency authorization.
That's right.
Yeah, so there's quite a bit of backlog, but there's so much good stuff out there, and we've seen a number of impact investors interested in helping those solutions scale up to the point where then government can take over, which is something, Tom, you and I have talked about a lot, about the relationship between impact investors and government. We play, philanthropists and impact investors, a really important role in getting new technologies to that commercialization stage. And there's been a lot of effort on the COVID response in the area of testing, and there continues to be a huge need there. Okay, the next question is around contract tracing, and I'll let you, Syra and Jennifer, decide who's the best one to answer this. But the question is, the pandemic unfortunately has advanced to the point has the pandemic advanced to the point where contact tracing has really been eclipsed?
So I can take the first shot of that, and then Jen could certainly add more to it. So I'm heavily involved with contact tracing. So one of the hats that I play within our system is I'm the health and safety lead of the Enhanced Investigations Unit for Test and Trace of New York City. And so we have a very robust contact tracing workforce. So you can't say the same for the rest of the nation. So if you're actually looking at, so one website that's good to go to is the COVID-19 exit strategy. And it tells you, is contact tracing being overwhelmed in a given jurisdiction? And unfortunately, what you're seeing is almost every state, you're seeing they're being overwhelmed because of the high number of cases and the low number of contact tracers. But that's not uniform. So we absolutely need to invest more in the contact tracing realm, just on the personnel and the infrastructure side. If you go to some of the public, for New York City, we actually published how well we're doing with our contact tracing efforts. We have some metrics. And so some of these metrics are, first, do people pick up the phone, and then once they pick up the phone, do they actually complete the entire intake process? We have a goal, for example, anywhere from 75 to 90%. And we have been able to achieve that goal uniformly, throughout the pandemic, luckily, and there've been some up and downs. We also look at, are we able to solicit the contacts of that case, and how many people are they giving us? We actually have a metric for that, and we are doing well. And then a big thing is, are people actually staying put? So for those that actually have to isolate, for those that have to quarantine, you're seeing an over 90% compliance. And when we do call them every day and say, hey, did you leave your house? About 95 to 98% are stating no, they haven't, because of the wraparound services that are being provided to them. So that shows you the impact of some of these wraparound services and why they're so important. So this data sometimes is very hard to go by, because unfortunately we still have a patchwork system in the United States that is being rectified right now. But it's very different at the state level. So I think just to close out, I think we certainly need a lot more support when it comes to contact tracing nationally.
Maybe just to quickly add to that. So while the case numbers are clearly way too high, I think for most jurisdictions to get the kind of coverage with contact tracing that maybe was possible in the spring, and also was sort of the goal to use just case-based interventions, testing, tracing, isolation, quarantine alone to keep the case numbers at bay. That said, I think that shouldn't be interpreted as contact tracing is no longer useful, because while it is probably not possible to conduct contact tracing on all cases, there certainly is a need to conduct contact tracing on as many cases as possible, but particularly certain cases, and cases, for instance, that work in congregate settings, where it is probably much easier to conduct the contact tracing, and there is very much a need to identify the people who have exposed, people who work in health facilities, nursing homes, other kind of very large group settings. So that's important. Also, we need to do some amount of contact tracing still, because we still do not have a great sense of where the virus is spreading. We know from the cases, they tell us, they tell people where they've been, but that doesn't tell us where they got it. And so some amount of understanding transmission chains is, I think, really important for us to better understand what environments are starting clusters of cases. We hear a lot that people are, infecting their families at home, and that absolutely certainly is happening, but we don't know where the index case is getting infected, that first patient. And if we can figure that out, we can possibly reduce community transmission through either making those places safer or possibly putting restrictions on them. So I don't want to entirely leave anybody to leave with the idea that contact tracing is completely useless. It is actually quite necessary, even if it can't be conducted at the scale that we would wish right now.
I think I'd also like to add that this is a fantastic workforce that can also play a role in educating on vaccines as well. And we're working with a group at UCSF that is planning to do just that in the city of San Francisco.
Awesome. So next question is really around balancing the impact, the opportunities for impact in smaller communities that are very hard hit versus things with broader regional efforts that might have a greater impact when you think about volume and numbers. And I think this maybe gets to what is government doing, what are the capital markets doing, and where are the gaps? But I'd love to hear the group's response on that.
I think the money inherently is going to flow to the larger scalable organizations, and that leaves so many gaps, particularly I think where equity is concerned. There's this balance between speed and equity, and I think the big money is going to go to where there's speed, and that isn't necessarily going to be equitable. And so I think there is a need for engaging with grassroots organizations that are on the ground to tackle this, and we can help make those connections and funnel money into those types of organizations.
Okay, we have time for just one or two more questions. This one is for Sharon. In these model, actually, there's many questions for Sharon, so I'm going to try to wrap it up in one. But there are a lot of people asking about how to connect with Stop the Spread if they're a grassroots organization who'd like to be, considered in your toolbox or the list of services that you might bring into to disadvantaged communities. There was also questions about how philanthropists might engage, with some of the organizations and efforts that you're working on. And so I think generally there's an interest in how to work with you.
Yeah, great. I'd say, well, I'm happy to have any conversations offline after this with anyone who'd like to contact me. And I think they're going to flash some contact information here on the screen. We have a fund as part of Impact Assets that we can use to deploy money directly into community-based organizations and into novel solutions. But we can also play matchmaker and can help just make connections and direct money into organizations that have a need that we're aware of. We also have just an enormous network that if you're looking to contribute to a specific type of need or in a specific geography, we're happy to do the legwork for you to find an organization that would benefit from where you'd like to contribute philanthropically. So we have a small but mighty team that this is what we live for. So happy to engage with anybody offline afterwards and arrange a call to see how we can help.
Okay, terrific. Let's see if we can do one more. There are some questions specifically around how do we stress the urgency of the moment and break through the misinformation, disinformation, the fatigue, all the things that are sort of mounting against human behavior in this pandemic, and what are some ways for us to engage on that difficult question?
So this is Sarah. I'll just quickly start. This is something that we're certainly focused on right now from a healthcare delivery standpoint, and it all starts at the community level. We want a lot more community engagement, and we want to do it in a way that's obviously thoughtful, and it's looking through what problems there currently are and actually talking to people. Surveys are great, but they don't give you the full picture. It's actually talking to individuals and seeing where some of this disconnection lies and then addressing it head on. So some of the things that are happening at the community standpoint, is engaging with leadership, faith-based leadership, different organizations, and then knowledge is power. So how can we provide information that is culturally competent, that's informed by trauma-informed care, all the guiding principles that we have, and then meeting people where they're at. I think the two things that we are trying to strive for is engagement of citizenship. So engaging the citizens in the response. And so oftentimes people feel as if, well, they can't do anything, and we want to empower them to do what's right, and then giving them the information that they need to make informed decisions. And so there's a lot happening on that front. And again, it's all with the lens of cultural competency. And I think the other thing that I'll just quickly highlight that is just so important in outbreak response and preparedness is just responsible leadership and having good information that is driven by science and evidence-based, and that is driven by experts that actually have been in this field, that are knowledgeable. Early timing and early intervention plays a big role. So you just can't emphasize enough the importance of good leadership happening at the top, because you can have the best plan or policy, but if it's not going to be followed, it's a failed policy.
Thank you, everybody. Thank you, panelists. Thanks, everyone, for coming. This was a terrific discussion. If you have questions, would like help organizing your philanthropy in 2021 or your impact investing in 2021, please reach out to Sharon at Stop the Spread. They are they exist to help us solve these problems and help us get activated. And Sharon's available for any of those questions. Thank you so much, everyone, for being with us today.